Home2Health is a collaborative project led by the City of Fort Collins, our community partners, and an incredible group of organizations and community members who want to have a positive impact on housing affordability and health equity in our community. Our task is a big one: to change the way we approach housing and health in Fort Collins, and to remove barriers so that all members of our community have an equal opportunity to thrive. The goal of the Home2Health project is to recommend changes to the city's housing regulations and policies so we can improve housing affordability and health equity in Fort Collins. Ultimately, all of the changes we are considering will have a real impact on people. That's why Home2Health is built on a foundation of community dialogue and capacity building. The voices, stories, and ideas of people who are experiencing the day-to-day reality of housing instability need to be reflected in the decisions we make. Maybe you have heard some of these stories. An aging resident wants to downsize but can't find the right kind of housing options. Most houses and apartments they look at have stairs that are difficult to navigate safely. A college student has to choose between paying for housing or paying their other bills. As money gets tighter, they have to cut back on their grocery budget and purchase lower quality food options. A couple commutes long distances into Fort Collins every day because our housing prices are too high and they can't afford to rent or buy a home closer to work. Instead of going for a walk after work, they are stuck in traffic trying to get home. A critical piece of the Home2Health conversation is telling these kinds of stories about the everyday lives of people who live and work in our community. The stories we share will help us all gain a deeper understanding of the connections between housing and health, and will help us have a better conversation about how we want to tackle these challenges together. When most people think about health, they usually think about health care. We all know that going to the doctor is important, but it really only accounts for about 20% of your overall well-being. In fact, most of your health, about 80%, is determined way before you show up at the doctor's office. Your income, race, level of education, and physical environment play a huge role in how healthy you are and in the overall quality of your life. Think about your house, your neighborhood. The fact is, where you live has a dramatic impact on how well you live. Housing is a determinant of health that has a significant impact on health outcomes, including chronic diseases like cancer, cardiovascular disease, and diabetes. There is a critical linkage between stable, safe, affordable housing, the neighborhood, and health. We know that outcomes are not equal for everyone in our community. The darker colors on this Health and Equity Index map show parts of Fort Collins where people's health outcomes are more unequal. The index considers how different demographic, social, and health factors can impact a person's ability to thrive, and demonstrates that opportunity is not equal in all parts of Fort Collins. The takeaway from the index is this: not everyone has the same chance at a healthy, active life in Fort Collins. If we want to be a community where everyone has the opportunity to thrive, we need to address these inequities. Emphasizing health equity by identifying and trying to reduce barriers to housing opportunity is one of the key objectives of the Home2Health project. Housing affordability doesn't just impact one group of people or one part of our community. In our city of about 170,000 people, more than 55,000 have incomes at or below 80% of the area median income, or AMI. While many of these people may have housing that is affordable to them, there are many others who would qualify for affordable housing programs if there are enough houses, housing vouchers, and funding available. People who live in Fort Collins are increasingly cost-burdened, meaning that they are spending more than 30% of their income on their housing expenses. Nearly 60% of people who rent their homes in Fort Collins are spending too much on their housing. In our city, about half of residents rent. 17% of people who own their homes are also spending too much on their housing. That's a lot of people who are making hard decisions about how to afford their monthly housing expenses. These issues are affecting your friends, your family members, your employees, your clients and customers, your neighbors, and your coworkers. And maybe struggling to afford housing is a part of your personal story too. Really, we are all affected by the housing affordability challenges in our community. So, what can we do about it? As in many communities across the United States, the affordable housing issue in Fort Collins is complicated. There is not one policy or program that can fix housing affordability, and people have a lot of different ideas about what we should or shouldn't do about the high cost of housing in our community. What we can do is start talking about those ideas. We need to look at our toolbox. What tools do we already have, and how well are they working? Where can we strengthen or change policies to have a bigger impact? What new tools should we consider? These won't be simple or easy conversations, but they will be critically important. Please join in the conversation and share your stories, experiences, and ideas.